Okay. Hi, everyone. My name is John Benedetto, and my email is jwbened@clemson.edu, as you can see on the screen. This presentation is going to focus on two articles that center around ACL injuries and the risk factors that are associated with them. First, I have the article citations here. Firstly by Aiello et al., and then the other one by Cronstrom et al. And here are the first pages of each journal article as for your reference. So you have Aiello et al. This is the first page, and Cronstrom et al. Here is the first page for that one as well. So into the interesting stuff. Why I chose these articles. I myself have had a long history of sports injuries, be it concussions, dislocated bones, or torn ligaments. However, I've never torn my ACL, thankfully. So I wanted to learn more about what happens when someone tears an ACL and why re-injury rates are so high for an injury that is quite common in most sports. So for each study's objectives, Aiello et al. Wanted to review current literature and identify what was causing football, or that's how they call it in Europe, or soccer as we call it in the US, players to suffer from ACL tears so often. And in addition, Cronstrom et al. Wanted to review current literature to determine the causes of athletes re-tearing their ACLs after they were surgically reconstructed and had an ACL graft put in. So both studies use systematic reviews of previous research for their study designs, and they use these to make conclusions as to what the risk factors for ACLs injuries were. In essence, both groups of researchers identified what research had already been done on determining risk factors for ACL tears, and then synthesized the study's findings into a few different conclusions and suggestions for further research, just to make it a little easier for us to understand what the current research is out there. So therefore, the main results, for the main results, Aiello et al. Found that ACL tears are most common when an athlete made a sudden change of direction, and they found that ACLs tear when that change of direction occurs, and that re-injury rates were highest if the athlete returned to sports in less than 3 months. Also, they found that if contact occurred near the knee when the knee is invalgus, interrotated, or extended, ACL tear was very likely. On the other hand, Cronstrom et al. Found that if athletes were younger than 20, they were 3.53 times more likely to suffer a ACL graft rupture. They also found that if an athlete had low psychological readiness to return to sport, there was a higher graft rupture rate as well. However, in contrast with Aiello et al., Cronstrom et al. Found that knee positioning was not as significant in predicting the likelihood of ACL tear after reconstructive surgery. So there's definitely a big difference there. And so for conclusions, Aiello et al. Concluded that there needed to be a development of educational programs to prevent ACL tears in the future, and just kind of educate athletes on how it's best to help them stay safe while they play sports. And also development of a system to grade the severity of ACL tears and the cause of the injuries. Cronstrom et al. Concluded that there needed to be increased psychological support, as they found that low psychological readiness was detrimental to rupture rates. This psychological support needed to be made available for athletes who have suffered an ACL tear. They also found that current protocols for ACL rehab needed to be altered to lower graft rupture rates, because they figured that the current protocols were allowing a high re-injury rate too quickly. So finally, these articles are related because although they pertain to the same topic of understanding why ACL tears occur and that they occur at a rampant rate in sports, the studies really disagree on some of the minute details about the causes of ACL tears and re-tears. More specifically, Aiello et al. Believed that knee positioning at the time of contact was vital in determining the severity of ACL tear, while Cronstrom et al. Suggested that the knee positioning was of really lesser importance in determining the prognosis when dealing with a possible ACL injury. Thank you so much for your time.